Hello, welcome to part 31 of Clinical Physiotherapy MCQ series. Here we'll be discussing day-to-day clinical scenarios with detailed explanation. Let's move to question number 151. A 20-year-old woman is referred to therapist with a diagnosis of recurrent ankle sprain. The patient has a history of several inversion ankle sprains within the past year. No edema or redness is noted at this time. Which of the following is the best treatment plan? Option A, gastrocnemius stretching, ankle strengthening and ice. Option B, rest, ice, compression, elevation and ankle strengthening. Option C, ankle strengthening and proprioceptive program. Option D, rest, ice, compression, elevation and gastrocnemius stretching. And the answer is Option C, ankle strengthening and proprioception program. Explanation to this question is patient with recurrent ankle sprain benefits from proprioceptive exercises. Choice B and D are not indicated because of the lack of acute signs and symptoms. Choice A is good plan but not most correct because there is no mention of proprioception. Now let's move to question number 152. A physical therapist is performing a screening of a patient that has been casted recently on left lower extremity. Which of the following statements should be the physical therapist be most concerned about? Option A, patient report, I don't keep my extremity elevated like the doctor asked me to. Option B, the patient reports, I have been having a pain in the left calf. Option C, the patient reports, my left leg has really been itching. Option D, the patient reports, the arthritis in my wrist is flaring up when I put weight on my crutches. And the answer is Option B, the patient reports, I have been having pain in the left calf. Explanation to this question is pain may be indicating neurovascular complication. Now let's move to question number 153. During the gait evaluation of a patient who has a transfemoral prosthesis, a physical therapist noticed that the patient laterally bent excessively towards the prosthetic side during the mid-stance phase. Which of the following factor is most likely to cause this gait deviation? Option A prosthesis that is too short. Option B, a prosthesis socket that is too small. Option C, inadequate prosthesis suspension. Option D, a locked knee unit. And the answer is Option A prosthesis that is too short. Explanation to this question is a prosthesis that is too short causes a patient to laterally bend towards the prosthetic side during the stance phase. Each of the conditions given in option 2, 3 and 4 which makes the prosthesis seems too long and none would cause the problem described. Now let's move to question number 154. A patient reports to the therapist starting that this sugar is too high for exercise. What is the minimal blood glucose level that is considered too high for a diabetic patient to begin exercise? Option A 300 mg per deciliter. Option B 400 mg per deciliter. Option C 300 ng per deciliter. Option D 400 ng per deciliter. And the answer is Option A 300 mg per deciliter. Explanation to this question is a blood sugar value of 300 mg per deciliter is a contraindicated level of therapeutic exercise. Now let's move to question number 155. A patient has been diagnosed with acute synovitis of the temporomandibular joint. Early innovation should be focused on Option A, application of intraoral appliance and phonophoresis. Option B, instruction to eat a soft food diet and phonophoresis. Option C, joint mobilization and postural awareness. Option D, temporary stretching and joint mobilization. And the answer is Option B, instruction to eat a soft food diet and phonophoresis. Explanation to this question is phonophoresis and education regarding consumption of only soft food will help resolve the acute inflammatory process in the temporomandibular joint. Application of an intraoral appliance occurs only when acute inflammation is not resolved or bruising continues. Joint mobilization should not be attempted with an acute inflammation. So that's all for today. If you have any doubts, please mention in the comment box. For further learning, keep in touch with the channel. See you in the next part. That's part 32. Bye bye. See you. Thank you.